peak infection rate
It's not
is still
working.
up to 3 months away, possibly into June. For now, there will be no UK-wide ban on large sporting gatherings, and schools will remain open, unlike in a number of other countries. The new advice today is that if anyone in your family or workplace has a new persistent cough or fever, they should stay at home for 7 days. It comes amid another jump in confirmed cases to almost 600. The total number of deaths also rose. 10 people have now died. So far, nearly 30,000 people have been tested. Our first report this evening comes from our political editor, Laura Kuensberg.
For self-employed Mike, stuck at home waiting for tests.
So there is no statutory sick pay for me. I haven't earned a penny since the start of March, and I'm really sort of now hoping to get on with life.
Or Kay, who's been told to wait for her symptoms to go before she goes out again.
It's my husband's birthday tomorrow, so we've cancelled our plans and we're going to have an isolation party at home, just the two of us.
For Johnny, who has symptoms but can't get a test.
In some Western senses is understandable because I'm young, I'm fit, I'm unlikely to die of this thing, but at the same time, like, the day before I came down with it, I spent it sat next to my 90-year-old granddad watching the England-Wales rugby game.
The virus is already affecting many of us.
Good afternoon, everybody, and thank you very much for coming.
From tomorrow, we're in a new phase, with some new rules, but not yet the most drastic action.
This is the worst public health crisis for a generation. I must level with you, level with the British public. More families, many more families, are going to lose loved ones before their time.
A deeply sober and extremely unusual message to the country.
From tomorrow, if you have coronavirus symptoms, however mild, either a new continuous cough or a high temperature, then you should stay at home for at least 7 days to protect others and help slow the spread of the disease. We advise all those over 70 with serious medical conditions against going on cruises, and we advise against international school trips.
How sure are you that the approach you're taking, holding back from some of the more drastic measures, is the right one?
Asking elderly people to stay at home, that's one thing that you really got to time, as Chris and Patrick have been explaining, so that it coincides with the period at which the epidemic is really at its peak.
People start off with the best of intentions, but enthusiasm at a certain point starts to flag. If you start too early, and then people's enthusiasm runs out just about the peak, which is exactly the time that we want people to be doing these interventions, that is actually not a productive way to do it.
But hang on, in Scotland, the First Minister has pushed further.
Mass gatherings require to be policed. They require to have emergency ambulance cover. We are minded now that we will advise the cancellation, also from the start of next week, of mass gatherings of 500 people or more. And that is principally to protect the resilience of our frontline workers.
And listen to this, Ireland's leader taking more drastic steps already.
Schools, colleges and childcare facilities will close from tomorrow. Where possible, teaching will be done online or remotely. Cultural institutions will close as well. Our advice is that all indoor mass gatherings of more than 100 people and outdoor mass gatherings of more than 500 people should be cancelled.
Number 10 is well aware, outwardly, they're taking a less stringent approach than some other countries, even our near neighbours. But that is based on what they say is the best scientific evidence they have, in the genuine belief that we are in this for the long haul, perhaps 3 months from the worst. And more draconian measures will only have an effect if they're taken at the right time. Rushing into drastic action might not be the safest route.
Are we too late to be taking measures now? Should schools be shut?
Above all else, this pandemic means the first job is to protect the nation's health. But this is also a test of the political judgment and competence of those in charge. Laura Kuensberg, BBC News, Westminster.
The Prime Minister said the most important task was to protect elderly and vulnerable people when infections peak. The most dangerous period is still some weeks away. Our special correspondent Lucy Manning has been talking to some of those who are most at risk.
The older generation, the workers, the vulnerable.
The delay phase will mean changes for everybody's lives. Older people are most at risk. The advice today is just to protect themselves. But at Chelmsford's Age Concern Lunch Club, the worries are, will they be asked to stay in more? Should they be staying in more?
I don't want to. They get to finish me off.
Lillian Gowers is 84.
This is what keeps me going. Really does. Just eating with people and seeing people.
Mother and daughter Tracy and Sue Mortimer have already changed their behaviour.
Well, I've basically locked her down. That way she's not on buses, touching things, touching handrails. You know, it's about battening down the hatches, I thought.
Scary.
Yeah, it is scary. It's scary. It's not just a cold. It's, to me, that would be a severe flu. To my mum, that would be a fatal flu. And people aren't getting it.
There are difficult conversations going on in families across the country. People telling parents and grandparents they need to change their behaviour and follow the government advice. Soon life at home and at work is going to look very different for some weeks, even months. For workers, a cough or temperature means stay home for a week. At this creative agency in Brentwood, business has been affected. The government not yet telling firms everyone should work from home, but they're ready.
I think too much of a situation where we act too soon will have a negative impact. So I believe that the government is doing the right thing at the moment, but I think that big decisions will be made over the next few weeks, and we will have to adapt.
And the vulnerable are already suffering. Amy Emery has multiple sclerosis. Her treatment weakens her immune system, so it's been delayed.
As I am at a high risk category of contracting disease, like the virus, I don't think that I would want to even leave my house at the moment, really, because it is quite scary.
A Prime Minister warning many more families will lose loved ones before their time. Perhaps the most sobering message this country will hear. Lucy Manning, BBC News, Essex.
Well, with the government moving into the delay phase of its plan to tackle coronavirus, what is the thinking behind today's measures and the impact on the NHS? Our health editor Hugh Pym reports.
Taking precautions, regular disinfecting on London Underground to try to reduce the virus risk. Today we learned the peak of the epidemic could be 3 months away with many more cases. So what can people who are infected expect?
Some of the people on the group that I was skiing with had fallen ill.
Andrew tested positive after a skiing holiday in Italy and is now self-isolating at home till he recovers. What are the symptoms, or what does it feel like having the virus?
I've had worse flu without a doubt. I'd say the most debilitating aspect is the uncontrollable coughing. That is probably the worst bit. The rest of it, the fevers is no different to a normal flu-type symptoms, and I'd say it's not to be worried about.
This is what the government thinks would be the peak number of cases without new measures, late spring and well above NHS bed capacity. With the interventions, it's hoping to flatten the peak and delay it.
So we're trying to reduce the number of cases at any one time. That's very important for NHS in order to make the NHS able to cope with this. And it's also important because it pushes it out into summer months where the NHS is less busy. And
he said reducing virus cases much more would be difficult, but that might not be a bad thing.
It's not possible to stop everybody getting it, and it's also actually not desirable because you want some immunity in the population. We need to have immunity to protect ourselves from this in the future.
Medical authorities have written to doctors today warning them there'll be extreme pressure and they might have to work in unfamiliar areas. Many are concerned for their patients and their own health.
My colleagues, the nursing staff and everybody in intensive care are very much in the front line and are at risk of contracting the illness, which may be mild or may be severe, from patients they treat. So it is something that really does focus the mind and is a great concern for us at the moment.
There was no specific new advice for older people at home and others who are vulnerable to the virus. Age UK supports the government's approach, but has called for more detailed guidance.
The
people who are in particularly vulnerable situations, perhaps because they're living with somebody who's at risk, maybe they've had a cancer treatment, maybe they're an older person and they're caring for them, I think people like that do need some more advice and they're bound to be anxious.
The new instruction to people to stay away from work if they have symptoms will affect many businesses. This car repair centre in Suffolk already takes employees' temperatures twice a day. If they're too high, they're sent home. All employers will now be keeping a close eye on their staff's health. Hugh Pym, BBC News.
Our medical correspondent Fergus Walsh is here with me now. So many countries, France, Ireland among them, shutting their schools. Many asking here why that's not happening.
The government is adamant that it's being led by the science, and the scientific advice is that unless you were to shut all schools for 3 months, it would barely have any impact on suppressing the epidemic. And they don't think banning mass gatherings at this stage would have much effect either. What the government is relying on is altruism, and that means self-isolating for 7 days if you have a cough or a high temperature, and eventually it will ask whole families to isolate for 14 days if one person in that household is infected. But that's not coming yet, nor is asking the elderly or those with underlying health conditions to isolate themselves, because otherwise that might have to be for months.
And we heard today that peak infection rates may not be till May, June even. Is the NHS ready for this?
There's no doubt that the NHS, especially intensive care, is in for a rocky period. Most people will get a mild illness, 4 out of 5, but 1 in 20 may need critical care. The main therapy is oxygen, they may need a ventilator. Now that's where we've seen the biggest pressures on hospitals in Italy and China. Now the big unknown is what proportion of the UK population are going to get this, and we simply don't know that yet, so we don't know what the pressure will be. But the aim now is not to completely suppress the epidemic. We need to start building up what's called herd immunity. But a final point, Sophie, it's worth stressing that 99 out of 100 people who get this will survive it, but it's going to be a bumpy few months.
Fergus Walsh, thank you. Well, there's been turmoil on stock markets around the world today.